Hello, CASW members. I was just sending a tweet to say that we are live, and here we are. I am so happy you are joining us from wherever you are, wherever you're at. Speaking of which, get on the Twitter and let us know if you are signing in today from anywhere to join us for part 2 of this incredible 2-part webinar series with the Fraser Health Authority. As always, my name is Alexandra Zanis. I am the Social Policy and Communications Coordinator here at the Canadian Association of Social Workers. I am so happy you all are tuning in for another hour-long webinar with us. Wherever you are, wherever you're at, we're so happy you are taking time out of your day to join us. So, a couple little housekeeping notes as always. If you are a veteran webinar attendee, just disregard me for a second. If you're new to this platform, welcome. We're so happy to have you. Everything on your screen is completely customizable, meaning you can make the video bigger, you can make the slides bigger. You can really play around with the platform so that it fits your viewing needs. One thing that I like to say is I like to try and keep the video open, the slide deck open, and then the chat and Q&A function. The chat function allows you to type in and have your questions be promoted to the whole group, or your chat promoted to the whole group. If you have a very specific question and answer, feel free to use that Q&A box. I don't want any of the questions to get missed for our Q&A section at the end. So just try and use the Q&A box if you have a dedicated question, and the chat box if you want to just talk about the presentation. Let us know where you're tuning in from. Let us know how this translates to your practice. Whatever you want to do, use that chat button there. Whew, it's a lot. Like I said, we're joined. I know, right, Randy? I'm like, oh my gosh, I feel like I'm talking a mile a minute here.
That was a big sigh.
Yeah. Okay. Next step. What's the next step we have today before we get launched into this presentation? Certificate of attendance. If you need that certificate of attendance, you have to view 40 minutes of this presentation, and then that's accessible on the bottom. You should have some blue widgets on the bottom there. It's the one gray one is your certificate of attendance. 40 minutes, you'll get that. You can log on anytime to access that certificate of attendance, as well as the handouts for today. You can log on anytime through this platform and access any of that. I am wearing my purple shirt today because we are in Ontario and it is Dress Purple Day to support children's aid societies across Ontario. Let us know in the chat box if you are in Ontario and supporting this initiative as well. And yeah, let's get into this incredible presentation. I'm going to pass it over as everyone starts to pump in here. We do have a slide here up. Let us know where in Canada you're logging in from. I realized it's been a while since I've done a webinar now that everyone's going on to online learning. So I wanted to see where everyone's tuning in from. Take a minute, answer that poll. I'm going to send the tweet. All right. So now I'm going to pass it over to our incredible webinar presenters. You may have seen them in our first part of this webinar series. We're joined by Fraser Health Authority, some incredible presenters. I'm on the back end today if you need me. Use that Q&A or chat box to get a hold of me, or else take it away, Fraser Health Authority.
Thanks so much, Alexandra. We're delighted to be here. We really enjoyed our last presentation. We're hoping that most of you who are here with us today are repeat customers, people who were there with us before and will be able to engage with us again today. I'm going to move along in these slides and just begin as we always like to here in Fraser Health is in British Columbia. We want to gratefully acknowledge the lands that we live, work, and play on. And the ones that we're specifically presenting from here in British Columbia are the unceded territories of the Coast Salish peoples. And I just want to express my own personal gratitude and hope that it resonates with others, that especially during this time of COVID-19, I'm grateful for the way in which the Coast Salish nations have cared for and their stewardship for the lands here, both historically, currently, and in the future, because during COVID, I've definitely needed to access the grounding that I find on these lands. Including today. So I want to express that gratitude and acknowledgement to begin today's presentation. Just to highlight what we're hoping to accomplish in the next hour. And it may be ambitious, but we're hopeful that it's going to be engaging and possibly even lead to further conversations and dialogues after today's presentation. So we're first going to start off by doing a really brief review of the 5 steps of advanced care planning, specifically for those of you who weren't able to attend our last webinar. We want to make sure there's a clear understanding, and for those of you who were, we want to make sure that we're all on the same page, again, about those 5 steps of advanced care planning. We're then going to talk about briefly the homework that we gave you at the end of last session. I know you probably thought no one was going to hold you accountable, but we are going to ask you a little bit about any advanced care planning action steps that you maybe participated in or did since our last session. What were the successes? What were the learning experiences? And what were any challenges or barriers that you've encountered? And then really what we're hoping to accomplish today is the so what part of after this. I don't know if you're like me, but after I attend a webinar and I learn a lot, to me, the next question is, well, what are the next steps? So what? What do I do with this information? Now that I know and understand way more about advanced care planning, what do we do next? And that's what we're really hoping to engage in a dialogue today. So I'm really happy to see all of you who are already accessing that chat function, because that's where we're hoping to be able to engage with you. If we were in a room today with all 84 of you together, we'd probably break off into small groups and have smaller dialogues where we would then bring those big ideas to the larger group. Because we don't have that luxury, we're hoping that we can just engage individually and collectively by using that chat function today. You may remember this slide from our first webinar where we kind of highlighted that when we discuss advanced care planning, while we may have attended here specifically thinking about it from the context of how we might support our clients in doing advanced care planning, it's very, very quick before we realize that this very much applies to us in our personal lives as well. And so we hope that today we'll be able to discuss, as we did last time, how advanced care planning relates and applies to you. How advanced care planning relates and applies to you as a professional, and specifically working with your clients. And then also we talked about last time how it relates to you as a facilitator or a mentor to those around you. And in today's context, the way that we're going to talk about that is how you can use your organization or the professional associations that you're a part of to be able to continue to use and engage in advanced care planning and to champion it. So what are the 5 steps of advanced care planning? If you'll remember, the first step is think. And what are we asking you to think about? We want you to think about your values, because your values dictate and inform your decisions, specifically your healthcare decisions. And so by reflecting on what a good day looks like, what it is that brings our life meaning, or even more simply, what brings you joy, allows us to make sure that that we're making and those around us know that the healthcare decisions that we're making are in a way that we can continue to do those things that bring us joy and living the way that we want to live. The second step is learn. And what we're hoping to learn is to learn our preferences around how much information we like to know about our medical status and what's happening, how we like to make decisions. What are our preferences in terms of making them independently, collectively with the family, or maybe allowing our family to make the decisions for us. And even more importantly, learning more about our health and what's going on for our health. What is our current understanding of what's happening? What does it mean for our lives? And especially in the context of how we like to live. And then 3 is decide, and that really has to do with the law. We want to understand that there are laws across this country that dictate who can make decisions for us if we're not able to make them for ourselves, and who's able to provide that consent if we're not able to. So decide is an opportunity for us to better understand what are the laws in the jurisdiction or the province or territory that we're living in, and who is it that I would want to articulate my wishes if I wasn't able to for myself. The 4th step is to talk. Obviously, none of this information is helpful if we don't actually have the conversations with people around us about our values, about what we've learned, and about what we've decided. And so talking is a critical part. Some people sometimes think of these conversations as difficult or hard conversations. We like to reframe them as important and gifts that we can offer those around us. And then that last 5th step is record. Obviously, taking time to be able to record all that information and those conversations and those values and what we've learned is important. And we can record it in any way, whether it's pen to paper, whether it's on a computer, whether it's in poetry, whether it's a recording, a video recording, an audio recording. There's multiple ways. And as we've articulated before, and I think we did last time, is that when I look at these 5 steps, I see a pie. That might be because I haven't had my my snack this morning, but I see a pie with 5 pieces. And if you're like me, when I eat pie, I never eat it in the circular, polite way of eating it. I always go and which piece I want. And it's the same thing with advanced care planning. It is not a circular or linear process. It's one where you might start and think and then spend a lot of time and talk. And then you might go over to learn and then spend a lot of time and record. Or maybe you'll just spend a lot of time and decide, and that's okay. Advanced care planning is a process. It's not a step-by-step essential, you must do it this way kind of process. So here's our follow-up from our homework. And I'd really love any sort of engagement in the chat that you're able to do with us. We'd love to know, since our last session, what successes you had with engaging with any of the 5 steps, either in your personal or professional life. So maybe you started a joy list or started thinking about, what brings your life meaning. Maybe you started having those conversations with those who are important in your life. Maybe you started bringing up the topic with clients that you work with. And so in that context of you sharing some of those things that you've done since our last session, we'd love to know, what were things that you learned, or what were any challenges or barriers? Because we'll be the first to admit that, especially if you're not consistently or confidently engaging in advanced care planning, there can be barriers and challenges that come up for all of us. So I'm gonna leave some awkward silence until we get some of you kindly sharing some of the things that you've done since our last advanced care planning webinar. Well, it feels like awkward silence. I know that people are actually typing right now. See? Melissa, way to get it started. Melissa gave a presentation in advanced care planning to other primary healthcare providers here in Nova Scotia. Love it. Thanks, Melissa. Thought more about my values that it applies to planning. Thanks, Jan. Reviewed with my mom her wishes as her cataract surgery made her nervous. Love that. Helped some clients complete personal directives. Thanks, Ian. I had a unique and unexpected opportunity to talk about ACP with a client, and I was able to talk about their goals after surgery and quality of life. This was something I hadn't done before, and it felt more comfortable. I love that. Difficult to get everyone on one page. Yes, it is difficult. Spoke with my husband about my wishes and listened to get an idea of his wishes. Discussed it in most of home care visits. Well done, Natalie. I love this. So let's, oh man, they're coming in. Talk to my daughter and husband, and it was fairly easy talking about it. The biggest challenge to these discussions is ensuring that everyone is on the same page. We did a presentation with our team. Mm-hmm. So yeah, let's transition from, this is awesome sharing. Thanks guys, I'm loving this. Let's transition from these successes or things that we've done with advanced care planning to talk about some of those challenges or those barriers to doing advanced care planning. Talked about ACP with my parents. I'm named proxy and it felt important to better understand their wishes. Organize a webinar. Guys, you guys are awesome. Like this is the best homework response ever. But yeah, let's hear, in addition to you guys sharing, and thank you for being so generous with your sharing, those things that you've done or successes that you've had. What are some of the things that you learned in that process, or what are some of the challenges or barriers that you encountered? I heard very clearly that there are some barriers with ensuring that everyone, I like to think that that means maybe the people who are important in your clients' lives or in your personal life are on the same page. Biggest challenge was with my husband was in pain and not the best time to talk to him about this. Sure. And Judy, you're not alone. Sometimes people find it best to even schedule a time to have these conversations so that everyone's emotionally prepared to be able to talk about it, right? Anybody else, any challenges or learning that you've had in this process of doing all this? The lack of knowledge. Parents were uncomfortable, it said at first. Said that, yeah, the dismissive Trisha, the dismissive, you'll know what's best. Elizabeth works in long-term care with seniors and talks about often low-income seniors can't afford a lawyer to appoint a power of attorney. I did my own pre-COVID ACP. Guiding through their grief and loss can be challenging. Yes, the biggest challenge is that the tools are not available for diverse communities, especially those with language barriers. Amal, that's a great point. I think there's some really great resources out there that we definitely need to make more accessible from a language barrier perspective. Siblings being on different pages. Oh, absolutely. procrastination with family, putting the conversation off. These are great. I love this. So thank you. I'm going to keep them coming, guys. I think there's real value in seeing all these challenges. And I think they're going to really contribute everything that you've shared with our next conversation that we're going to have. So basically, this next section is so what? And my team always laughs at me because that's exactly what I call these sessions, is after you've done all this great learning, and even in the last session, we gave you that workbook as a tool and a resource to be able to use in your personal life or your professional life. But we were really interested in the so what. So what? What are we going to do now? Especially now that you might feel a little more empowered, a little more confident, and a little more comfortable with advanced care planning. What are the next steps? So I'm gonna turn it over to Randy, who's going to just guide us again in a discussion. Today's workshop is more you guys teaching us, you guys talking more than we are in terms of engaging in that chat function. And we just want to hear you answer some of these questions regarding so what. So go ahead, Randy.
Awesome. Thanks so much, Andrew. That's really, really good. And you guys are absolutely on fire here. Like the responses have been just fantastic. That's just great. I'm so glad that you all really took to your homework and found creative ways to initiate some advanced care planning conversations, both professionally and personally. I guess the other point I want to make is just, Andrew, you really had me concerned with the pie thing. We get together as a group sometimes for social things. At least we did pre-COVID. Now we've never shared pie. But all eyes are going to be on Andrew the next time we do share pie, because I thought you were going to go for a spoon right for the center of the pie, Andrew, the way you were talking there. So you had me a bit concerned, but you brought it all home. I think we're going to be okay. So this is good. So the thing that I wanted to ask is, I just wanted to engage in a conversation with you guys about the personal aspect of advanced care planning. So, I mean, we all know someone who's died, and I think some of us even expect to die ourselves. So none of us are immune. We're all mortal beings, and we need to ask ourselves, when will we begin or continue to have advanced care planning conversations, and how will we initiate these conversations? This is one of the topics that comes up very, very frequently with healthcare professionals with whom we work, is they find it difficult to initiate conversations. And one of the suggestions that I often have with them is to start with themselves, to really explore personally their own wishes. What is it that they would want themselves, and how would they communicate their wishes to those who they love? Some of the suggestions that we've come up with and that we've heard are things about finding examples on the news. We're a Canadian crowd here today, so I guess I'm thinking of our very own Alex Trebek, and how vocal he's been in regards to his battle with pancreatic cancer. So something like that, even in watching Jeopardy, to bring up to your family, what do you think of this? Alex is looking pretty good. How has his battle gone? You know, if I was in his position, I think I would. How about you? There, an advanced care planning conversation has started right there. Certainly looking for other family situations, uncles, aunts, cousins, whoever it might be. Other mortal beings who are further along on the path than we are ourselves could serve as examples where we might be able to initiate conversations. So it's one of these things for us in the advanced care planning world. These conversations come really, really easy to us. I think for some of our family members, they might even come a little bit too easy. My 20-year-old daughter's always asked me, Dad, why do you always have to talk about this stuff? And it is because it just does become so natural to me. One of the other suggestions we've heard is to blame someone else. So suggesting that, I was at the doctor today, and the doctor said I should think about this, and think about what I might want in the future with my congestive heart failure. So that's a good way of bringing it up. I think some of you are probably old enough that you remember back in the days when you would travel and go to the airport. And I remember seeing the little insurance kiosks along the way. Some of them were right in the departure lounge where you'd be able to buy travel insurance. And I just draw a parallel with advanced care planning. I mean, that's really leaving it to the last minute, don't you think? Buying your travel insurance in the departure lounge just before the plane takes off. Others are really, really much more mindful. And when they're planning their trip and their travel agent suggests, do you have travel insurance? Then they think, oh, yes, of course, definitely need travel insurance. So advanced care planning is sort of like having insurance for an unplanned, unscheduled future event. A good strategy that I really think helps is starting with your own story. So instead of asking a loved one what they would want or what they would wish for or what they've done with their own advanced care plan, is rather to share your own story and share what you're thinking. It's a whole lot easier for someone to shut you down if you're just speaking about your own experience and your own preparations. So really what our goal is to normalize advanced care planning conversations and to have earlier, better, and more advanced care planning conversations, both in our personal and in our professional lives. And the way all of you really seem to have taken to things in the past, in the past while since our first presentation has been really, really good. Advanced care planning really can help avoid unnecessary family conflict during what's already a really, really difficult time. So there's so many benefits there. Advanced care planning also really increases the likelihood that your death is going to occur on your own terms as much as possible. Giving you time to say the goodbyes, the I love yous, and the I'm sorries, things that you may not be able to do if you hadn't thought and planned ahead. Another question to ask yourself is, if you knew that the end was near for you, what would you choose to do with your remaining time? What's important to you? What is it that you'd want to do? And what steps could you take now to ensure that if the end was close, that this would be able to be possible for you? For some people, it might involve spirituality, family, specific friends, animals, nature, music, TV. For some, it might even be watching sports. I was going to give a little dig towards the Ontario people and their beloved Maple Leafs, but I saw that there wasn't too many people on from Ontario, so I'll spare you my little Maple Leaf dig. So, how do we encourage those close to us to have these conversations? I think we encourage our friends and family to have these conversations by first sharing our own thoughts and wishes with them. So we contribute to this by creating a culture and an environment where these important conversations are possible and where they occur. An example that I've given in the past is one about depression. Decades ago, people would never talk about depression. They would just suffer in silence. And over the past couple of decades, things have really, really changed. And people are now much more vocal and much more open about depression. And thereby it doesn't have the same taboo or stigma that it once did. People talk much more openly, and when one person speaks about it, it gives everyone else permission to also share about it.
Randy,
so advanced care planning gives us. Sorry, Andrew.
No. Finish your thought. Go.
No. So I think what we want to do is be able to celebrate and acknowledge lives lived well. That's something else that we can do. If we see someone who has lived a life on their terms and lived right to the end on their terms, I think to acknowledge that, to point that out, and to celebrate that, and to endeavor to ensure that the same is possible for you as well as to the loved ones, your loved ones and your friends and people close to you. And Andrew, I don't know if you wanted to jump in. I wanted to tell a quick story about about a close friend of mine who.
I'll just jump in before you tell your story, Randy, because what we're really hoping is for people to engage in the chat with these two questions. And so it'd be really fantastic if, while you're telling your story, if people could share some thoughts that they have related to themselves and those who matter to them, whether they're friends or family. It'd be really fantastic for you to share, what will you do after today to begin or to continue those advanced care planning conversations? Or what will you do after today, or how will you encourage and support those who matter to you, your family, your friends, your colleagues, to begin engaging those in advanced care planning? So if people could start filling in the chat with some of those thoughts and ideas that you have while Randy tells the story, that'd be fantastic. So sorry, Randy, go ahead.
No, no problem at all, Andrew. I appreciate that. So I just wanted to tell a quick story about a colleague and close friend of mine who was an occupational therapist and a musician. He was a 32-year-old man. He was married and he had a newborn baby at home. Unfortunately, just after he brought his baby home, literally within days, he was diagnosed with cancer. And he initially fought it very bravely and courageously and was hopeful and optimistic that everything was going to go well. Unfortunately, as the weeks and months would go by, chemotherapy, radiation, and all the rest, the cancer didn't respond well, and he was suffering really bad side effects from the chemo and from the radiation. So after some time and some discussion with his family and with his friends and those close to him, he accepted the prognosis and chose to change the course. So he began receiving a palliative approach to his care, which was able to largely control the pain that he was under and reduce some of the side effects that he was suffering from. In his final days, because music and his friends were so important to him, in his final days, he was able to leave the hospital for an afternoon. He was able to sit with his friends in a sunny outdoor area outside the hospital. He was able to play his drum and enjoy music with his friends. He was able to say his I love yous, his goodbyes, and of course, shed a few tears. So, in thinking back towards my friend and the way his life went and his death went, I'd say what he had was a good death in the end. And I think by supporting these conversations and encouraging them within our own personal relationships and family relationships, we can ensure that others close to us also are able to live their lives fully, completely, and as happily as possible until the very end, which is really what we're aiming for. So, Andrew, I'm curious what's coming in on the chat.
Yeah, we haven't. There's been a little bit of engagement. I'd love to. I'd love to know more if people want to engage the same way that you guys were so kind to share with kind of what you've done so far. I'd love to know what you're going to continue doing. Specifically for yourself, for your personal, for you and your own advanced care planning, or for the advanced care planning related to those who matter to you. I would be really interested in knowing how you plan to have these conversations or continue them. How will you encourage those who are close to you or continue to encourage them? Trisha's sharing how once she explained why it's important and what ACP is for, family was much more open to engaging. I love that. Natalie's going to make sure that it's documented. It's a great suggestion. Sometimes we have really great conversations, but we forget ways to document it. So thank you. Amanda's sharing that since our last session, she did some care planning for her daughter and appointed a guardian in case my husband and I die unexpectedly. Thanks, Amanda. Preparation for conversations is helpful for all. I end with a common understanding as to when we would next further the discussion to encourage decision making. And Louise, I think that's pointing to the fact that, we always say that this is not a single conversation, nor is advanced care planning a single event. It is a ton of conversations. And so it's definitely more than just one, and it's kind of building on the next one. Heather, start by having a conversation with my husband regarding my wishes, and then to make it formal by doing a written advanced care plan. When anger is expressed, I usually help them to get into it and allow all the time they need to express their anger. Yeah, it's interesting because we find that, again, sometimes some of that resistance to people engaging in these conversations is part of what obviously, and we're all social workers here, so I don't need to teach you how to be social workers, but part of what de-escalates some of that resistance is just by validating the discomfort, the grief, the anger, or any of those feelings that are coming up related to even talking about, someone who matters to you and their mortality. And so I think just through that validation and acknowledging that it's a hard conversation is a gift that you're offering them, right? So this is great. Laura, I'm going to just be mindful of time. I'm going to turn it over to you and we can talk about another area for reflection.
Great. Thank you, Andrew. And thank you, Randy, for all of your stories and your thoughts, and to everyone out there for sharing as well. We're greatly appreciative of how engaged all of you are. So we're going to slide into this next section about more of the the professional hat, right? So we started off with Randy talking more about the personal hat, and then we're going to switch gears looking more at our professional hat. And I find a lot of it can be translated quite well. And so I'm actually going to throw these questions at you guys right away here. Hope you can engage and think about some of these things that can apply to when you're working with your own clients from whatever scope of practice that you're coming from, whatever setting you're coming from, because I'm sure all of us are from diverse settings, not necessarily just healthcare, which, Randy, Andrew, and I are all speaking from more of a healthcare perspective, but being able to come together and think about how can we put this into the different settings that we work in. So the first question here, how will you bring up advanced care planning, or how will you respond to questions about advanced care planning with clients, right? So if this comes up in conversation, or you want to start a conversation with your particular clients, how do you move forward with that? And I'm going to leave a little bit of awkward silence to let you guys type out some answers.
I look forward to these answers because I suspect they're going to be different than for those of us who work in healthcare. Because I have a very strong feeling that the majority of you potentially do not work in healthcare settings, either work in community or private practice. And I'd love to hear about how ideas or thoughts about how you could bring it up. Sorry, I filled in that awkward silence, Laura.
That's okay. So Roy says, I engage the client and family usually upon admission to the PCH I work in. So that's good. Starting that conversation earlier on there. So there's that expectation and a way to start things moving forward. Advanced care planning can be discussed while talking about the importance of a power of attorney. That's very true, because a lot of times people, when they think of advanced care planning, they think of the finances. So, other than Ontario where they have the different language there, people might come up talking about power of attorney, and you can use that as a segue. So working in long-term care, and part of our assessment is asking if they have a power of attorney. It opens the door. There we go. Same kind of idea. And then being able to talk about the benefits there. Sorry, just going through and reading because we've got some fantastic answers here. I'm having a hard time keeping up. Sorry, Andrew, if you don't mind, because I think I'm a bit on the slow side here.
So there's a lot of people talking about doing it as part of admission, and I love that. Like, rather than saving it for a later conversation, whether in long-term care, home health settings, community settings, and I'm even seeing people talking about working in a busy emergency department, that there's a way for them to be able to initiate the conversations and then send them with information home. Starting to ask clients part of their intake. You know what excites me about people talking about doing it on intake and admission and at the start of engaging with clients is that one, it normalizes it rather than it coming out of the blue later. And two, what I really appreciate is that I always say when I'm working in the hospital, we're such a deficit-focused model that we're focused on what's wrong with people that I wish that we could start with asking people what's right with them by finding out a little bit more about them and why we're trying to get them better, right? Working with people with intellectual disabilities, I think it's valuable to research and use tools using variety communication styles. Yes, we're working on simplified tools as well for that community and others. Sorry, Laura, go ahead.
I was just going to throw in an addition because I kind of started noticing a bit of a pattern out there, both with kind of the personal hat, not so specific with the professional hat here, but just kind of a plug that advanced care planning is about life, right? I know what was really helpful for me in my practice was when I was starting these conversations with clients, just really focusing about we're not focused on your death so much, but we want to improve and see what we can do for you while you're still alive. Because oftentimes people, when they have chronic illnesses or issues, they can live for years and years and years before things start to decline towards, a dying kind of progression. So even in those times when I've been working with patients where I'm not even sure about my rapport with them, and I don't know how to seamlessly have these conversations with that particular person, I simply was able to ask, do you value quality of life, or do you value quantity of life? And I find that often opens up the floodgates, and quite often clients are very open to having those conversations. So I just wanted to put that in there, because quite often clinicians, they do believe that advanced care planning is more about death, and that's something that people we find in the public as well believe. When we're talking about advanced care planning, we're talking about death and dying, which is just a teeny tiny portion of the bigger picture with advanced care planning.
Laura, I also noted before
Laura,
you move on, I don't know if you noticed that I picked up on for people who are working with what we might call marginalized or vulnerable members, so people working with individuals with intellectual disabilities, or maybe folks in addictions, or individuals who are experiencing homelessness, just that oftentimes their wishes may not always be honored, or their experiences with the healthcare system may not have been positive. And all the more reason to be able to have these conversations and to help them feel empowered, knowing that that we do want to know their values, and we do want to honor them in relation to healthcare decision making.
Yeah, which also speaks to
Laura,
the diversity piece, right? Being able to provide sensitive approaches to advanced care planning for the diversity of people that we do end up working with.
Laura, can I just highlight one of the questions or one of the comments that one of the attendees made? Heather suggested it's a large part of their role in long-term care and important to have multiple team members to have this discussion. So I think just really highlights the point that advanced care planning conversations aren't the role of simply, say, the physician, but these are discussions that can and should take place with many different team members throughout a patient or a client's journey through whatever system a social worker might be working. So I think it's really our job to look for opportunities to insert advanced care planning conversations in creative ways in whatever setting it is that we might be working.
Yeah, and in a way, in responding to Cheryl's comment, in a way that doesn't make it sound like, oh my goodness, you're dying, or you have a serious illness, and that's why I'm bringing up this conversation, right, Randy? In a way that I would approach every single one of my patients or clients that I would work with, and even when I was working in the field of HIV for years, what I was more interested in wasn't the fact that they were basically publicly health mandated to take a certain medication. What I cared about is why did they want to live longer by taking that medication? What was the why behind the living longer? What brought that person to the hospital if I'm working in ER? What is it about getting better that's important to them? How do they want to live afterwards? That's really what advanced care planning is, and I think it's a gift when we can have those conversations. Sorry, Laura, we're hijacking.
That's okay. We wanted this to be a discussion, right? And we've got it here amongst ourselves who can have their voice heard on this platform, and we've got some rich discussion in the chat, which is fantastic. This is what we want, right? I'm just going to jump ahead to that last question on the slide. Hopefully, you guys will be able to take in all of these questions that we're proposing forward to you guys and think about them even after this discussion that we are having today, just so that you can think and move forward and see how else you can implement this into your various worlds. But how will you respond to client concerns related to family conflict and their advanced care planning? Because as all of us being social workers, we know family are hardly ever on the same page. It's lovely when they are, but quite often there's even different dynamics within families that can cause issues along the way. So wondering from you guys, how would you respond? How would you approach that?
While people answer, I'm just going to respond. Judy asks, what would we suggest for social workers working in homeless shelters with clients who do not have anyone in their lives to speak for them when they cannot speak for themselves? So again, Judy, what I would encourage is one, depending on where people live, there's different laws. So I can only speak to how we do it in British Columbia. But, I always acknowledge when I was working with homeless population is that they have their street family, as I like to call it, right? Rather than their biological family. And that if people have individuals in their street family who they would rather be their substitute decision makers than their immediate family because of that relationship and how they know them so well, then I, here in British Columbia, would do what we call a representation agreement. What do they call it in Alberta, Laura?
Personal directive.
Thank you, a personal directive. I think in Ontario, it's called a power of attorney for healthcare decisions. And so I would appoint someone or people in their street family. And so there's ways to be able to get around it for sure and working with those populations. But again, knowing what the law says in terms of who people can choose to be their substitute decision makers in where you're living is an important first step. Sorry, Laura, now the answers are all yours.
I'm just trying to write down some of the themes that I'm seeing as people are coming up and discussing
Smart.
Their answers to this last question here. And it sounds like some people, they like to have that conversation with the client and the family around common goals and figuring out, where is that conflict and is there some way that a resolution come together through those common goals. I believe I read something there about, kind of focusing on a bit of the law piece there where if a person has made a request for decision making, that substitute decision maker must follow those wishes.
Yeah, Judy, you're right. Sometimes there might have to be legal involvement in some family situations, right? And it's tragic yet necessary. I think I loved the question. I think Nicole asked it, which was, what is the outcome of that conflict? Like, what are we trying to achieve? And here in healthcare, we used to call it goal concordant care, but we're really transitioning to this language of value concordant care. We really want to make sure that the person's values and how they want to live is informing healthcare decisions, even if other people's values within that family completely conflict. We want to ensure that not only would that be a way of honoring that person and what their values are, but it also reduces a lot of the anxiety, guilt, and stress that comes with families questioning whether they made the right decision or not, if they're the decision maker themselves, right? Anything else you wanted to highlight, Laura, before we move on?
I don't think so. I'm just keeping an eye on the time, so it might be good so that we have a question and answer period at the end. Just kind of plug along. It's great, you guys, if you still want to keep discussing these types of questions and answers throughout, within the chat box, that's fantastic. We love that. But take it away, Andrew.
Thank you. And I really want to acknowledge on this slide that when it comes to doing advanced care planning with your clients and patients that you're working with or individuals that you're working with, I almost guarantee that all of you are already doing it. Maybe you just weren't calling it advanced care planning before. And so we always name that when we do our education with our healthcare providers here in Fraser Health, we always very, very quickly name that you guys are already doing this. Like, you're already learning about your patients, your clients, who's important in their lives, what they like to do. And sometimes it just gets hidden in our chart notes a little bit. And so just finding more effective ways so that it doesn't just get lost in that initial first assessment, but that we realize that some of that information that we gathered in those assessments or in those conversations with our clients is actually the information that's going to support them in making their healthcare decisions. And they might not even know that. And empowering them with helping them realize, wait, you just told me that you love soccer so much, and that watching it and playing it is the most important thing to you. Maybe you should keep that in mind the next time that you're going to the hospital or have to make a major healthcare decision, to ask the doctor if you're still able to play and watch soccer. And they might be surprised that would be something to bring up with their doctor, but that's exactly the decisions that we want to make so that we are ensuring that we're living the way we want to. So this last slide,
And,
oh, please, Rennie.
Andrew, I just wanted to make one more point. I mean, in the discussion, Cheryl had earlier made a point about an emergency being afraid of bringing this up early. People would be worried they have something serious going on that the doc hasn't shared. So, Cheryl, I just wanted to say to you as well as to everyone else that in my experience, the emergency room and the ICU are some of the worst places to have advanced care planning conversations. And I don't think this is real early. In fact, I think this is often, in my experience, it's been very, very late. Certainly, if it's a minor admission, if you're going in for stitches to emergency, probably not the place for an advanced care planning conversation. But it made me think of my example of the airline travel insurance. If you were afraid of flying and just before you were getting on the plane, they're trying to sell you travel insurance, I think you'd be going, oh my goodness, is the plane going to crash? This isn't good. So, I mean, that makes perfect sense. So when I say that what we want to promote is earlier, better, and more advanced care planning conversations, that means having these conversations outside of the hospital when we're well. I really liked your example about the soccer, Andrew, because I used to work on a rehab unit. And that was one of the things is where would we raise the bar after someone has had some sort of orthopedic injury, for example? Where would we set the bar? Is the person an Olympic athlete that wants to get back competing? Or is this a person that is quite happy to ambulate between, their couch and, in the bathroom in a wheelchair? We're not going to raise the bar as high, and we're not going to offer the same interventions. So their values are really going to dictate the sort of care that's provided.
Thanks, Randy.
Thanks, Andrew.
Yeah, and then as we transition to these next questions, really how we wanted to kind of wrap this conversation up is, so what about advanced care planning in your organizations and your professional associations that you're a part of? So I guess the question that we want to ask you, and what we'd love for you to continue to engage in the chat, and we've really, really appreciated those of you who have, is how much your organization, where you work, whether it's a large healthcare system or whether it's a private practice or your professional associations, whether that's your college, whether that's CASW, normalize and encourage advanced care planning among colleagues and members. So we really want to start having this conversation around how your organization and or professional associations. I'll give you a couple examples while you're typing. Here in Fraser Health, one of the things that we've recently started to do is we've created what we call here in British Columbia, a practice council, where essentially we've brought practitioners from various disciplines, whether social workers, occupational therapists, physicians, nurses, but essentially people throughout Fraser Health that work both in the community, home health, acute care, wherever it might be. And we bring them together in a practice council as a way to be able to improve the education we provide, the resources we create, the systems work that we're doing. And so that is the way that we've tried to change or normalize and encourage advanced care planning here in Fraser Health. Judy, great suggestion. Organizations should do workshops like this one. And Judy, depending on where you're located, you're welcome to reach out to us or Alexandra, and we can connect you with the folks who are responsible for advanced care planning and are able to support you and or their organizations in doing those workshops for sure. What else could you do? I know this is a big question, and I'm hoping maybe even Alexandra jumps on and just to put her on the spot and see what she thinks even our professional association, CSW, could do.
W can do, because it's always such a good question. Well, one of the big things that I think as our professional associations is starting the conversations almost always around advanced care planning. So doing webinars like this and then sharing this webinar is a great thing. So I like to say, because we put everything on our YouTube, so both of these are going to be on our YouTube as accessible formats. If you need subtitles in another language or closed captioning, et cetera, maybe do a teach-in day where you do part 1 and part 2 of this webinar series with your organization and your colleagues. it's free with the CASW if you're a member. So you can take these learning opportunities into your organizations and have these conversations as the change makers that you all are. And then, of course, at the CASW, we're going to continue to do stuff like this, Andrew. Don't you worry.
I'm not worried. What we've actually enjoyed as well with the CSW is that a lot of national and provincial organizations have position statements on advanced care planning. And in a recent conversation with the CSW, we discovered that we, as a body of social workers here in Canada, don't have a position statement on advanced care planning as a way to actually declare our advocacy for it, our support for it. And so that's some of the work that we're doing and that we're starting with CSW as well.
That's a great point, Andrew.
I'm loving some of these answers. And then Melissa, in Nova Scotia, we're currently doing virtual workshops on advanced care planning for the public. They're presented via Zoom and interactive. I attended one last week. I'm loving this, guys. Anything else? How, and I guess that next question, I'm hoping, and then we'll wrap it up in the next 3.5 minutes. How might your organization or your professional association champion advanced care planning within your communities? So not just within the membership of your organization or professional association, but within the communities in which you work. How might your organization or your professional associations champion advanced care planning in the communities? Again, I'm hearing webinars and education is one great way. I'm curious if there's other suggestions. They can email this link to other social workers in our organization who haven't seen it. Great suggestion, Judy. I'm sure Alexandra wouldn't mind that at all.
Yeah, absolutely. Actually, all of our webinars during COVID are open to everyone. It's not just for members to encourage social distancing. So those of you who maybe have an interest in the profession but aren't a CASW member, you actually can access this webinar and then share it with anyone else who isn't a CASW member. So
absolutely. Thanks. Nicole's suggesting that we promote it for our own staff. And it's interesting because I think when we promote advanced care planning for our staff, sometimes it always feels like as a professional, like how does this apply to you as a professional with the patients or clients you work with? Whereas on the contrary, what we're finding is that we're promoting it with healthcare staff to attend our public sessions, similar to the one that you attended last time with our workbook, so that they're doing their own advanced care planning for themselves and for those who are in their lives as a way to promote it. So I'm going to leave, unless people are still typing, if you are, still finish. Stanley, what a great idea, having a booth at Pride Festival. Yes, having booths back when we used to get together and have festivals, and definitely as a way to be able to get it out there. And I think there's ways for us to think creatively. If nothing, what COVID has done for us has made us think outside the box. It's definitely forced us to be slightly more creative, for sure. And so I definitely want to leave this question with you, because I think this is the bigger question. I'm not going to be surprised if all of us leave today and are doing better with advanced care planning in our personal lives and in our professional lives. I'd be more interested in knowing what are we going to do next in our organizations on this larger, more macro scale, and with our professional associations. And I'll just leave those questions with you. So in closing, we wanted to review these resources that we shared last time. Again, we encourage you to visit our advanced care planning website, which is fraserhealth.ca/ACP. We have an amazing national advanced care planning organization based out of Ottawa that covers all of Canada, and you can visit them at advancedcareplanning.ca. There's also a great resource called peopleslawschool.ca that really kind of takes more of a lay description or teaching of the laws related to advanced care planning. And then, of course, we have our First Nations Health Authority that has a really, really fantastic resource related to advanced care planning that's incredibly culturally sensitive and was engaging with the community in its creation, with the Indigenous community in its creation. So with that, I just want to turn the time over to any additional questions that you might have.
Yeah, so most of us know this drill. If you've done any of the webinars with us before, this is the time for the Q&A section. So you have about 10 to 15 minutes of these presenters' time to ask your questions. You can put it in the chat since we don't have too many, or you can put it in the Q&A. And then once those start coming in, I will ask our presenters. I have a question on my own.
Please.
So my mother has made me the executor of her will. And she just called me and told me this recently. There was no real discussion about it. I wonder, and she did this and it came in. And I wondered about if that would be an opportunity for me to discuss about my directives. And I wondered your guys' opinion about like, would I be stealing the space where I am allowing her? I want her to be able to talk to me about hers, but I also want an in to potentially start talking about mine. Do you guys ever have anything to say about like not overpowering that conversation or how to bring it up?
Alexandra, as social workers, I hear you asking for advice, and we do not give advice. We are not advice givers. So I'm just going to have to ask you. I'm going to ask you the question right back at. No, I'm just joking. That's not what you were looking for. Randy, you looked like you had something to add.
No. I just find this very interesting. And in my previous work as a social worker at a specialized seniors clinic, I was faced with this quite often because an adult child, typically someone in their 50s or 60s, would bring in their parent, who was usually in their 80s, and would say something to their parent like, now listen to the man, mom. And I would certainly go through the material, the advanced care planning discussion with the parent, but then I would also turn the table back to the adult child who brought mom in and remind them that they too are mortal beings, and all of the stuff that we're discussing with their mother or father is also equally relevant to them. So, I mean, I guess all I would advise you to do, Alexandra, is just finish the conversation with your parent in regards to their plans and their wishes. And once that conversation is drawn to a conclusion, then saying, I was thinking about that myself, and then just simply transitioning into your own discussion and thinking about your own planning. And, back to Cheryl's point in the discussion, far better to have these discussions now rather than in the emergency room or in the ICU.
Yeah, Alexandra, I'd say you were handed a gift, right? Rather than you having to have the awkward, what's the conversation starter for advanced care planning conversations, your mom's just like, hey, I've assigned you to be the executor, and be like, hey, mom, did you know there's another thing about life planning called advanced care planning that actually isn't necessarily about death, but it's about our healthcare decisions. And it, and then it's about baby steps. And where do we start there? Like for me with my parents, the very first thing I'm not their executor for their will, and I'm grateful because there's too many kids in my family, but I am their healthcare decision maker. And the very first thing when they were just like, where do we start? I said, just make a list of the things that bring you joy. I just want your joy list, because that's going to be the most instructive gift to me, that if there ever is a health care emergency, I can share that with the physicians and ask what on that joy list they would still be able to do after making the decisions, right?
Yeah. Brilliant.
So definitely.
So the answer is yes. I love it. So here's a question, and this one's very interesting, actually, and I'm intrigued to hear your guys' responses to it. So working with clients that have a lot of religious concerns in terms of their advanced care planning wishes, and oftentimes their clients' wishes may stray from their cultural norms or family norms. So this individual's example is if you are involved in the Catholic faith, oftentimes you go through a traditional burial or funeral, whereas their clients oftentimes don't want that. They want to be cremated or et cetera, et cetera. And this is obviously very specific to dying. So I know you're advanced care planning, but any comments about how to try and navigate the waters when there's like religion and or like political conversations to be had as well? And maybe when your client differs from the status quo, social norm, and family.
Laura, do you want to take that on first?
Well, I think the first thought that comes to mind for me is just deconstructing the conversation, because it all comes down to values, and there might be some similarities, there might be some differences in values, and being able to have those conversations, or as a social worker, help support a client in having those values conversations, because that might actually get more at a root of something, and maybe it won't. Sometimes it doesn't, but that's kind of my first thought with a starting point.
Yeah, no one wants to be told that their values are wrong, right? Like that's our values are not only they're linked to our identity, because our values inform what we wear, who we hang out with, activities we engage in, and everything like that. And especially faith values that give you not that they give you that existential idea of who you are and how life functions. And so for me, what I find in those conversations is that it's really just important to honor everybody's values. And again, it seems so simple, but there just needs to be space for that, of acknowledging, yes, Grandma, thank you for sharing your strong values according to your Catholic faith. It sounds like that's really important to you, and how you would make a decision if this was your life or your situation. This is what you would choose. And Dad, thanks for sharing that, because it sounds like you would choose something a little bit differently in this situation, because such and such is really important to you and you really value this. And so just leaving space and really using those basic social work principles of meeting people where they're at, moving at their pace, but allowing that validation for everyone's values. And then reminding that ultimately it's about what that person wants and values, right? And at least here in British Columbia, when it comes to healthcare decisions, the law requires you to honor that person's wishes and values. That is your sole responsibility as a substitute decision maker, is to honor their values, not your values.
Yeah. Awesome.
And then I saw one last question. Oh, sorry, Randy.
I was just going to say, Andrew, and that's certainly something that a quality that you want to carefully consider when choosing a substitute decision maker or a representative for yourself, is someone who is able to suspend their own values and their own beliefs in order to respect yours, because ultimately it is about respecting, the individual's preferences and wishes.
Yeah, I think it's important to remember these are typically not health crises; these are emotional and family crises. And so if you it is the norm for there to be conflict. It is not the exception. And that conflict is usually just around values and around allowing everyone to be heard related to their values. I just want to answer, I'm mindful of the time, Alexandra. I see Elizabeth put a question in the Q&A about what would happen if someone appointed a decision maker on their behalf without speaking to the person first. Terrible idea, by the way, newsflash. And the person they name is not willing to act as their decision maker when the person can no longer make decisions. Elizabeth, again, I don't know where you are in this country, what province or territory you're in, but I can tell you that here in British Columbia, we have qualifications related to someone being a substitute decision maker. And the very first one is that they need to be willing and able. And so if someone chooses to decline, we will not be going to them. It doesn't matter whether or not they've been legally assigned or chosen as a representative, or even in that moment. If my wife is the one to be my substitute decision maker and she's too emotionally overwhelmed or doesn't feel comfortable, they will not be going to her because she's declined. She's not willing in that moment. And she might be better the next day, and then we would go back to her because she was legally assigned to be that person. But in that moment, if she's not willing, we're not going to go to her. Again, that's here in British Columbia. The laws may be a little bit different where you are.
Yeah, no, we're good for time for those who want to hop off. You know that the webinars are always recorded, so you can come back on if you have to leave this very second. But since I don't know if we have any more questions. If you do have a question, type it now, because we are getting in on the end of this webinar. I just wanted to say thank you to our webinar presenters, and I hope they're reading the chat and how grateful everyone is.
Well,
as
thanks,
I wait
Alexandra.
for more.
Yeah, no, we've really appreciated being here. And please, if you have more questions after today, please email us at advancedcareplanning@fraserhealth.ca. We'd be happy to not only answer questions, but also do any sort of ACP system navigation within the jurisdictions that you live in. Our lead, Carrie Barenko, who's on the call with us today, she's well connected across this country, and so we'd be happy to connect you to any resources or individuals where you are.
Yeah, for all of you, you probably saw Carrie in the chat. She's been on this whole time as well, so she's here too to help us out.
I am, thank you. In the background.
She's there.
I'm the third leg, silent one.
Exactly. So awesome. I mean, everyone says this was fantastic. I'm not seeing any more questions. We did get a lot of questions already, so I'm sure people just felt like they were answered which is incredible. If you want to get in touch with us at the CASW, you always can. We always want to hear from you. Twitter, Facebook, email. Those are the ways that you can reach us. I want to hear how you liked this event. So there should be a survey. And if there isn't a survey, just let us know. We never know with these new webinar platforms what makes it on and what doesn't. If you want to bring advanced care planning back into the conversation, let us know about that too. If you want to keep having this discussion, we can keep doing these. We want to hear from you and what our membership needs and wants and likes. So use that opportunity to let us know. And then any final thoughts from our presenters before I wrap up?
Just thank you so much for supporting this. It's been wonderful and certainly something that I wanted to see for a long time. So I just think it's lovely that we've been able to get the social workers across this country together on this topic. Thanks.
Yeah, actually, Carrie reached out to us to do this. So be grateful that she did it. We didn't go find her. And now we've been able to offer two really incredible webinars. So this will get posted on the YouTube in the next day or so. We'll be converting this onto the on-demand version within the next hour. And yeah, we'll see you guys then. My internet is stopping, so I'm going to stop the webcast. Thanks so much, guys.
Thanks.
Take care.
Bye.
Thank you.
Bye.
Thank you.
Bye, everybody.